Dr. Frederick Kozak is a clinical professor of pediatric otolaryngology. He is on staff at BC Children's Hospital and on top of the leading edge advancements in his field. On Sunday, a World of Smiles telethon takes place right here on Shaw TV and Shaw Multicultural Channel 116. Its goal is to raise awareness and funds for BC Children's Hospital. It is my pleasure to welcome Dr. Fred Kozak to Studio 4 to tell us more.
Thank you very much. Nice to be here.
Nice to meet you. You won't be on the air this year, but you'll be supporting it in your heart and in other ways.
Absolutely. I've worked with the telethon since I started on staff there in 1992. I think in the first year, as I recall, I had a child that was born with something that I've seen once and I probably won't see for the rest of my career. And he was featured in one of the vignettes. He's now 19 years old, so grown up, done well, and in fact, the Canucks were featured in his vignette, and so it's kind of timely that we're back into celebrating that as well.
Well, we certainly are. We're only 4 wins away.
It's true.
You know that.
It's true.
The good doctor said, right? So ear, nose, throat, head, neck disorders.
Correct.
In children. What's common ear-wise?
Well, what's very common would be ear infections. The surgical treatment of that would be tubes. We don't put tubes in as much as we used to. Having fluid in your ears. Long-term results are not as bad as we would have thought a number of years ago. We take out tonsils and adenoids still. Historically, tonsils and adenoids were taken out because of infection. But now we take out tonsils and adenoids primarily because of what we call obstructive sleep disorder. So kids who are having difficulty breathing, they're snoring, they're holding their breath, they're acting a little bit rangy, usually boys, and you take them out.
That's a given.
That's true. And you take them out depending on which child and the right situation, and their behavior improves, their sleep improves. So we've shown that that is something that's helpful.
Sure, as you know, in my day, surgeons were a little trigger happy with the tonsils. If you had a sore throat, especially if you had a strep throat, the next thing you knew, your tonsils were gone. Why do we need tonsils? What do they do in the body?
Well, tonsils are a first line of defense for fighting infection. They also produce certain cells that also fight off infection. Your adenoids, because people also equate them together, they're all from the same sort of embryological area. And other parts of your body take over, and so that's why you don't need them. And there are no detrimental known effects to having them been removed. Your adenoids, once you reach the age, certainly by 12, in the majority of people have disappeared. They regress. So you and I don't have adenoids anymore, but if you haven't had your tonsils out, they're still sitting in there. And there are other reasons to take tonsils out, but the main one in pediatrics are those two things.
But the adenoids at a certain age still sitting there, not doing any work.
Blocking your nose, and that would be another reason they'd run into trouble with breathing. They can have problems with secretions coming out. They can get a chronic-like infection, and it's not nice to have a snotty nose all the time, so we try and help them out that way.
Why do they swell up?
Just like anything, if you get trauma or you get infection, it's a normal response in the body for things to swell. There's an increase in fluid in the cells. There's an increase in secretion.
Inflammation, a big problem in many diseases, as you know.
Absolutely.
What about in the ear, inflammation in the ear? Inner ear, outer ear?
The ear's divided into 3 parts. We have an outer ear, a middle ear, and an inner ear. An outer ear, the most common infection that the public would know about would be swimmer's ear. Very common in the summertime, but you can also get it at any time during the year. People stick things in their ear that they shouldn't. For example, paper clips, toothpicks, cotton swabs. Shouldn't do that. It only causes problems. Wax is a good thing. Wax fights off disease, gives a little smell that mosquitoes don't like, keeps your canal moist.
Why do some people seem to have wax buildup and others don't? What's going on?
Well, we have wax glands, and if you don't let it fall out, it builds up. If you keep sticking something in your ear, that'll happen. As I said, wax is a good thing. It hosts or offers a whole number of different things, and Some people produce more and some people produce less.
Is there any reason if somebody has healthy ears to clean your ears, really?
No. In fact, in the adult population, the greatest cause of hearing loss is wax buildup. And so if you go to senior citizen homes, and in fact a former colleague of mine back in Hamilton who retired, and what he did, an ear, nose and throat surgeon, he went to all the senior homes in the Hamilton region and cleaned out the wax of the elderly, and they can hear better. It's the most common cause of hearing loss in that population.
Really?
Yes.
So when you say he cleaned out the wax, how does he do that?
Well, we do it in a whole number of ways. He was trained in an era where we didn't have a microscope, so he puts on the old-time headlight, and then you have a light bulb and it shines this way to that way, and then you can use small instruments, and with good manual dexterity and bifocals, I guess, at his age,
Right.
you can do it. We still do that. I've done that in certain parts of the world where we don't have microscopes, where we've gone on trips. Other ways that we do it here, if you came to my office, we would clean it out in a child using a microscope. In a family doctor's office, they would use irrigation.
Okay, so when the doctor looks in a child's ear with that little gadget, and I assume you still use it, but maybe you're more highfalutin now, you know, the one where they look in, they go, oh, you have a beautiful eardrum.
Yes.
Yes, that one.
That's called an otoscope.
Okay.
We still use that. That would be the mainstay of looking at an ear for physicians throughout the first world, certainly. Because I'm a subspecialist, we use a microscope because we deal with a lot of other common ear problems in children that are more than just fluid or recurrent ear infections.
And what would they be?
Well,
Example.
An example would be something called a cholesteatoma, which is a benign-like tumor. Think of it as skin in the wrong place. I'll see 25 or 30 of those a year. The operation to fix that's about 4 hours long. You almost always need a second operation. It destroys the ear bones. We have to take out the ear bones. We then put in new ear bones, a prosthesis made out of titanium. We would look in there to make sure everything's fine before we put a cochlear implant in. And I know there's a staff member here at your station who's had a son who's had a cochlear implant put in by myself in 2007. A remarkable device that has allowed him to be equivalent to his peers. I believe he's in about grade 1 or 2 now, and he hears.
Because of the cochlear implant?
Absolutely.
And is it a difficult operation to do, a long time to recover? Is it immediate? What goes on?
As my father says, easy when you know how.
I see, of course. Is
So
he a doctor?
No, he's not a doctor. But is it difficult? Well, you know, all operations,
Of course.
once you know how to do them, are quotes unquote straightforward. But you come across a whole number of challenges depending on the anatomy. No two people are the same. For someone like myself, yes, it is a fairly straightforward operation, but you do run into challenges at times that are not uncommon.
So advancements in the field of otolaryngology
Correct?
are what? Cochlear implant obviously been around for a while.
True.
What else?
Further advancements would be, for example, I have a patient that I have personally operated on 250 times. He's a little boy that was born with a windpipe that was very, very tiny, that wasn't going to grow adequately as the rest of his body grew. And he ran into some problems where it was initially fixed by myself and my colleague, Dr. Jacques LeBlanc, who's subsequently retired from cardiac surgery at Children's. And several weeks later, he ran into some problems with infection and things broke down. So the whole structure was rebuilt, but then it was floppy. So then he had several stents put in. And the reason I've operated on him so much in the last 7 years is because the airway has become plugged with tissue, granulation tissue, infected tissue, inflammatory tissue. So basically the pipe is plugged up. And my role would be to go in and clean the pipe, so his windpipe. Now he is on a honeymoon right now, and he goes through these periods, and I go through these periods where I don't have to operate as much. So sometimes I've been in there 6 hours, sometimes twice in 24 hours, and I don't operate on him now probably every 3 months. But the advancement that I'm trying to get to would be rebuilding his entire trachea as a possibility, which work has been done in Spain, work has been done in England, There's a place in Belgium. They've done 4 or 5 of these. The youngest, however, I believe is 16. One can envision this coming. They harvest a trachea that's been donated, and then they wash it and they put new cells on it, and then they grow it, and then you transplant it. So that is something that is happening and would potentially happen here in British Columbia down the line.
So as part of organ donation, you can donate a trachea?
Yes, you can, and they can save that.
Along with lungs, liver, heart?
True.
They can save the trachea, really?
Yes.
For a small child or an adult, for that matter, because I'm sure if you have some cancer or whatever, you may need a similar operation.
Well, we're talking, with cancer would be a whole different area. My subspecialty is that related specifically to ears at Children's Hospital, but in answer to the question, that is something that's on the forefront. There are other things that are coming down the line, ear-related, that if you don't have a cochlea or an inner ear, as we were talking before, that you can bypass and you can put a device on the brainstem that allows you to hear. It's still in its relative infancy, but it's something that's
amazing,
there.
isn't it, really, down the road, that a child who is born without the inner ear working or the little hair things. As I remember my science, there's lots of little hairs in here.
Little inner and outer hair cells.
Inner and outer hair cells,
Correct.
that type of thing. One day we may see a child never having to be deaf. Do you think? Or am I being too optimistic?
Well, I think that's possible, particularly in the field of future genetics, but there are a million causes of deafness. And certainly we've made major progress, but being deaf actually, from a cultural point of view, some people would say is not all that bad. But that's a whole nother story and a whole nother show. It's a whole other
story, yes, and we have that discussion over dinner sometimes. If you had to lose something, sight, hearing, talk, well, you know what I want to keep, right? Perhaps. Dr. Fred Kozak, our guest, will return.